My name is Árpád Jankó. I am a sixth-year medical student studying here at Semmelweis University, and I have two topics at the moment. Both of them are meta-analysis and systematic reviews. The title of my first topic is Investigating the Effect of Oral Contraceptives on Carbohydrate Metabolism. As I mentioned, this is a systematic review and meta-analysis. A short background about my topic is that oral contraceptives are one of the most commonly used forms of contraception. Over 70 million people use it globally. It's so popular because they're effective, they're comfortable, and their failure rate is 7%, but this takes into account occasionally missed doses. With perfect use, it's under 1%. It's also popular because of their non-contraceptive benefits. It reduces acne and dysmenorrhea. And as every drug, this also has side effects. And besides their well-known adverse effects, it's suspected that they can cause alterations in carbohydrate metabolism. So they could decrease glucose tolerance and increase insulin resistance, which could be risk factors for type 2 diabetes and cardiovascular disease. Because there are no conclusive guidelines in the matter, we aim to assess the safety and the effect of these drugs on carbohydrate metabolism. We used the PICO framework. We did a before and after comparison. Our systematic search was done in 3 different databases, resulting in 15,000 results. Finally, we had 120 full texts. A short explanation going forward. We had a lot of compounds, a lot of drugs, so we had to simplify it a bit. We decided to group them based on chemical structure. So, for example, the 19 nortestosterone derivatives, so the gonans are levonorgestrel, desogestrel, etc. So we use these 4 groups. These are the names that I'm going to reference on my future slides. That's my first figure. It might seem a bit complicated at first. It shows the change in our main outcome, OGTT glucose, in healthy patients after the use of OCs. I put 2 slides on the side just to better understand my first figure. It's a bit complicated because it has 4 different kinds of models on it, but the diagram on the right bottom shows us a normal oral glucose tolerance test at its different time frames. The red dots are the after, and the black dots are the before values. We looked at change, so the difference between the 2 of them. That's what's shown on my figure. And we also made 4 groups here. So we have a fasting value. We have an early value, which represents the fast-acting glucose. So it's the values that are before 45 minutes on the OGTT test. We have a peak category, which represents the values at 60 minutes, and we have a late category, which represents the values at 90 and after. So I'm not going to go into too much detail on my diagram, but the different colors represent different kinds of compounds, different drugs. For example, the red dots are drospirenone, the green dots are the gonans, as I mentioned, for example, levonorgestrel or desogestrel, and the circles are monophasic and the triangles are triphasic contraceptives. So a take-home message from the slide, without going into too much detail, is that there isn't really a difference between monophasic and triphasic contraceptives, but there are differences between the different compounds. So, for example, drospirenone here has a neutral effect on carbohydrate metabolism in healthy patients, while the other drugs have a negative impact by raising blood sugar levels. My second figure is the same, but in PCOS patients, where we didn't have any triphasic data, so these drugs are just monophasic, and it's quite interesting here that some drugs could even act oppositely to each other. So, for example, drospirenone can have a almost 2 millimole per liter negative positive effect on blood sugar, so it can reduce blood sugar by 2 millimole per liters, while the gonads and pregnenes have a negative effect by raising blood sugar levels. So this could be highly interesting. Just a short mention about insulin. We didn't have a big difference here. It can be because of a number of reasons. For example, insulin sensitivity could be altered, and that could be the mechanism behind why the glucose levels were altered. But this would need further investigation, of course. So my fourth figure is SHBG. This is in healthy patients. While the heterogeneity is quite big, it shows that in every drug group, the values grew. And this number is even more pronounced in patients that have PCOS. So the strengths of my article would be that it's been suspected that oral contraceptives have an effect on carbohydrate metabolism, but us creating these four groups and categorizing them based on chemical structure allows us to look at them individually and compare them to each other. So this is quite novel because this hasn't been done before, especially with this multi-level, multi-variable, quite complicated model. Our limitations would be that the population is quite diverse and fragmented, and we also have non-randomized studies as well. So our conclusion would be that the use of drospirenone improves or has a neutral effect on carbohydrate parameters, while pregnenes and gonads could negatively impact carbohydrate parameters, especially in patients that have PCOS. Our implication for practice would be that contraceptives are usually prescribed for cycle regulation and hyperandrogenic symptoms, but the effect on metabolic components should also be considered when prescribing these drugs. Our implication for research would be further prospective studies to be conducted to examine carbohydrate parameters in each different drug type. So we are at the phase of writing the manuscript. We finished the methods part, and we plan on finishing the manuscript in June. My second project is quite similar. It's investigating the effect of oral contraceptives on lipid metabolism. We plan on looking at alterations in triglycerides, LDL, HDL, which could be risk factors for coronary heart disease. And to summarize, I have two projects at the moment. We plan on submitting my first project in July, and that will be looking at carbohydrate metabolism. And then after writing the next article about lipid metabolism, which we plan on submitting in September. And thank you for your attention. As Kobe Bryant said, if you're afraid to fail, then you're probably going to fail.
Congratulations for a very nice presentation. In your figure 2, the protective one
Yes.
has effect only in the late phase and no earlier. Do you know the reason why it would manifest itself as protective only in the late phase?
Well, the late phase meant that it looked at values that are after 90 minutes. So I think we also had changes before, but the significant difference what I showed was at the late phase. Exactly why this is, I don't know. Fasting blood glucose levels have been examined before, but that is a static value. While looking at this tolerance test, this gives us a dynamic test, which could give us with more detailed information than before.